Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today, I want to come on and discuss what happens in a compensation and pension exam or a C&P exam for heart conditions or cardiac conditions. So we've done several videos on cardiac conditions and also several videos on what happens in a C&P exam. And I've been told, especially for the C&P videos, that this can really sort of ease some anxieties about what kind of things might be expected or might happen when you go to some of those exams. And a lot of this information is readily available. You just go over to va.gov and pull up that particular disability benefit questionnaire, and you can just review it. You can also ask your doctor to fill one of these out. And if they're happy to do it for you, and you may be able to use that for your VA claim. It's always best to talk to your accredited claims agent, VSO, or an accredited attorney if you have questions on the filing process or on strategy for your claim. But again, a lot of these documents are readily available on va.gov and are there for you to try to, have an understanding of what can happen. So after you file the claim, if you're scheduled a C&P, when you get scheduled a C&P exam, they're going to send you a packet in the mail, and it's going to tell you who the provider is, who the healthcare practitioner is that's going to do your evaluation. Is it going to be a PA, a nurse practitioner, a cardiologist, an internal medicine physician, or some other, kind of doctor is going to evaluate you for this. It doesn't necessarily have to be a cardiologist. Like I said, it can be a nurse practitioner or a PA. It's within their scope to evaluate these conditions as well. So it'll tell you where to go, what time to be there, and it will probably actually contain a DBQ in that packet. And if not, you can look it up. So how can a veteran be service connected? So it can be on a primary or a secondary basis. So on a primary basis, perhaps you had a heart condition in service on active duty that was either caused in service, or maybe it was pre-existing and it worsened beyond its natural progression or was aggravated on active duty. Maybe you were in a presumptive area that has some cardiac conditions related to it, be it non-veterans or other locations. Maybe you have a secondary service connection. So perhaps you have a condition that caused you to become obese, right? And as an intermediate step, it caused you to have coronary artery disease. Maybe you had a heart attack, things like that. Maybe you developed a valvular disorder after you had a heart attack. So let's jump into that disability benefit questionnaire and see what kind of questions are going to be asked. So I'm going to present this real quick. Give me 1 second. Okay, here we go. So this is the cardiac DBQ straight up off of va.gov. Let me make that a little bit larger. Okay, so on this first page, it's going to just ask for your information. And then this might be a little bit too, we'll go back to this size. So then it's going to ask that provider to fill out, are you completing this DBQ at the request of the veteran or others? So you can bring this to your own doctor and ask them to fill it out. You can print this right off of va.gov and see if they'll fill it out for you. Was the veteran examined in person? Yes or no? Evidence reviewed. So what evidence did they review? Did they have your claims filed? Do they have your VA medical records? Do they have your service treatment records? Do they have your civilian doctor's treatment records? The diagnosis. So what diagnosis pertain to this DBQ? So here it asks you to select one. You can have one or several conditions. So you can have, this list is pretty large. So you can have unstable angina, stable angina. You can have acute, subacute, or old myocardial infarction. This says that the veteran does not have a current diagnosis, this one up here. Coronary spasm, bradycardia, ventricular arrhythmia, congestive heart failure, supraventricular arrhythmia. There's several things: valvular heart disease, pericarditis, coronary artery bypass graft. And then there's going to be a catch-all down here for other, like if it's not listed up there, your doctor can just pencil in what your condition is, right? And then another additional block in case you filled out all of these three other diagnosis. Here's another catch-all. So medical history, describe the history, including onset and course of the veteran's heart condition. So this is where they're going to discuss, when did it start? How has it been over the years? Next question, do any of the veteran's heart conditions qualify within the generally accepted medical definition of ischemic heart disease? Yes or no? And then they want to describe it here. Provide the etiology, if known, of each of the veteran's heart conditions, including the relationship, causality to other heart conditions, particularly relationships, causality to the veteran's ischemic heart disease, if any. So with the heart, a lot of times these conditions can be overlapping or caused by one another, especially ischemic heart disease. So they want to know what are those interrelationships. Is continuous medication required to control it? If yes, list them. And then this next section is going to be for myocardial infarction. So if you didn't have a heart attack, if you didn't have an MI, then this section is not going to be filled out. If you did, this section is going to be filled out. Arrhythmia, does the veteran have a cardiac arrhythmia? Same if it applies. It says obviously yes or no. If it's a no, then you don't have to complete this section. If it's a yes, then the doctor should complete this section that as it pertains to you. If you have bradycardia or supraventricular tachycardia, AV block, heart valve conditions. If you have a heart valve condition, again, if it's applicable, they're going to discuss your heart valve condition. If not, then no. Pericardial adhesions. What procedures have you had? Has the veteran had any non-surgical or surgical procedures or treatment of the heart condition? Did you have an angioplasty? If yes, when? Let's see. Did you have coronary artery bypass surgery, cardiac heart? Did you have a heart transplant? Do you have a pacemaker? Do you have a automatic implantable cardioverter defibrillator? Heart valve replacement? Okay, so the next section down here is going to be about hospitalizations. Has the veteran had any hospitalizations for treatment of a heart condition other than non-surgical and or surgical procedures described above? So when were you hospitalized, if you were? And then there's a physical exam. So they want to know your heart rate, your blood pressure, was your rhythm regular or not, your PMI or your point of maximal impact, your heart sounds, were they normal? If they were abnormal, they're supposed to specify. Do you have JVD or jugular venous distension? They're supposed to listen to your lungs. Check your peripheral pulses. Do you have edema or swelling in your lower extremities? Other pertinent physical findings. So diagnostic testing, is there evidence of cardiac hypertrophy? And if there is, how was it documented? Was it on an EKG? Was it on a chest x-ray, an echo? Do you have cardiac dilation? Then they want to know all of your testing and the results. So did you have an ECG recently? Did you have a chest x-ray, an echo? What were those findings? Metabolic equivalent testing. So this can be important. So for VA purposes, all heart exams require METS testing, either exercise-based or interview-based, to determine the activity level at which symptoms such as breathlessness, fatigue, angina, dizziness, syncope develops. If a laboratory determination of METS by exercise testing cannot be done for medical reasons, then perform an interview-based METS. So a lot of the ratings are going to be based on what your METS are or your metabolic basically it's trying to see how well you are compensating for these heart conditions. What is your exercise tolerance? What are you able to do? So it asks what is the results of that. Again, the METS level checked below reflects the lowest activity level at which the veteran reports any of the following symptoms. So either you deny, so the first block is the veteran denies experiencing symptoms attributable to a cardiac condition. So basically the person is completely normal and not having any symptoms with activity. So is the person breathless? Are they fatigued? Do they have angina, dizziness, syncope, or other? And then here's some interview-based METS scoring. This is important, like I said. So 1 to 3 METS, the METS level has been found to be consistent with activities such as eating, dressing, taking a shower, or walking slow. So the person gets breathless basically with those activities. And then you can see it varies up from there, like light yard work, weeding, mowing the lawn, brisk walking. The next level is they're able to walk 1 flight of stairs or golfing. And then they have the symptoms. So 7 to 10 is consistent with activities of climbing stairs quickly, moderate bicycling, sawing wood, jogging. Okay. So then it asks if you've had exercise or interview based METS testing? If yes, indicate which test most accurately reflects the veteran's current cardiac functional level. This is important, right? Is the METS level provided due solely to the heart condition and the veteran is claiming in the diagnosed section? So is your METS testing score related to your actual cardiac condition, or is it related to something else? Like, do you have COPD or something? Is that causing you to have like breathlessness? So functional impact, they want to know, regardless of the veteran's current employment status, do the conditions listed in the diagnosis section impact your ability to perform any occupational tasks? Then there's some remarks, and then there's a signature block. Okay, so let me jump off of this screen share. Okay, so basically that's going to be what happens in one of those exams. So some of those areas might be related to your disorder and some may not. There might be multiple sections that are related. I hope this was helpful, and I hope it decreases some of your apprehension about a cardiac C&P exam. Thank you for watching, and see you guys next time.